It is being called a major drain of already scarce law enforcement resources.
A new report reveals the number of mental health calls for service has jumped 55% in the last few years, and officers say it is only going to get worse. Tonight, new at 6, police share with 10 News the steps they're taking to make sure that officers are still able to respond to other emergency calls.
Hey guys, you have no credibility with me.
61-year-old Mark Brown yelled obscenities at officers and threatened them with a knife as he paced in front of San Diego Police Headquarters. When he refused to put the knife down, dozens of officers were brought in for what turned out to be a 2-hour standoff. Crisis negotiators were even brought in. After all efforts failed, police fired a rubber bullet and a few shotgun beanbags his way. Officers then arrested him and hauled him to jail. This case from 2011 with the mentally ill person is just one of thousands that officers constantly deal with.
It's a big drain on resources.
A new report by the San Diego Association of Government shows just how big. The 4 largest law enforcement agencies in the county, San Diego, Chula Vista, Oceanside Police, and the Sheriff's Department, say in 2008 they had more than 14,000 calls for service for a mental health-related issue. In 2013, that number spiked to more than 22,000. That's a 55% increase.
It's very time-consuming, and obviously the more calls for service we have related to these people, the less time we have to spend on other issues that might come about.
Chula Vista Police say they have 2 PERT clinicians, a psychiatric emergency response team that rides with officers to help with these kinds of calls. But even they have become overwhelmed with the growing number of calls for service. Now, Chula Vista PD has asked for another clinician but was denied. So for now, the department is strongly encouraging its officers to attend the same training as those clinicians.